This is another study about the correlation of troponin homocysteine levels with coronary artery disease in patients on hemodialysis, also a preliminary study. So this is a multi-center prospective cohort study. 50 patients were included on hemodialysis with mean duration 31 months, 30 males and 20 females with mean age 67.6 years old. Patients divided into two groups based on the presence or absence of coronary artery disease, and serum troponin and homocysteine levels were correlated with normal laboratory values and among themselves. Biochemical assessment was at baseline, at 6 and at 12 months. So these are the examined parameters and the normal values. So there was a positive correlation between troponin and age in the first measurement, while there was no significant correlation between homocysteine levels and age, as well the mean age of patients with elevated homocysteine levels was 67.05, compared to those with normal homocysteine levels were 65.7. So using the cutoffs, we found that pathological troponin levels were present in 36% of total patients, that in 18 to 50 patients in the number, in all three measurements. Subsequently, homocysteine levels were correlated with the gender, and in the first measurement, homocysteine levels were significantly higher in males compared to females, although difference was not statistically significant. In the second and third measurement, there was no statistically significant difference in homocysteine levels between males and females. I can't see it. Sorry about that. Okay. Sorry, I can't see. I cannot see the topic. Yeah. Sorry. Okay, I'll tell again this slide. Okay, so troponin levels were present as 36% of the patients, and the frequency of pathological troponin levels is significantly higher in male than in female, as we can see in the diagram. So there is homocysteine, and there was no statistically significant difference between males and females. So as previously mentioned, homocysteine has been implicated as an independent risk factor for coronary artery disease and atherosclerosis. So in our study, it was observed that patients with CAD had statistically significant lower homocysteine levels compared to patients without CAD. And it was observed that patients with CAD had an increase in troponin levels than those without CAD. And the difference was statistically significant. So in the diagrams A and B, we demonstrate that homocysteine in the third measurement was not correlated with troponin levels, and troponin in the second measurement did not show a statistically significant change from the third measurement. But there was observed a change in homocysteine levels from the first to the second measurement was positively correlated with both initially troponin levels and the change in troponin levels. So in the diagram C, homocysteine levels in the third measurement were statistically significant and positively correlated with troponin levels. So the aim of the study was to investigate the association of troponin homocysteine levels with CAD and the risk in patients with end-stage chronic kidney disease. Troponin levels were found elevated in 36%, homocysteine in 78% of the patients. There was a positive correlation between troponin and age, and a positive correlation between homocysteine and troponin levels in both groups. Troponin levels were higher in patients with CAD, while homocysteine levels were higher in patients without CAD. The frequency of pathological troponin levels was significantly higher in women than in men. So, conclusions: troponin appears to correlate positively with homocysteine in both patients with and without CAD. Patients with CAD have elevated troponin levels, while patients without CAD have elevated homocysteine levels. Men appear to have low risk of abnormal troponin levels than women, but further analysis with more patients will take place in order to confirm or not our preliminary findings. Thank you very much.